Welcome back to Flashpoint. Our guest this morning, Mecklenburg County Health Director, Dr. Raynard Washington. Okay, let's talk about COVID. We're back now in the high zone when it comes to community spread. Does that now trigger a public health policy change?
It certainly triggers a public health recommendation change, and so we have shifted our recommendations to include recommending indoor masking for individuals, for everyone in the public when they're outdoors, when they're in indoor public settings, excuse me. And so that is in alignment with the CDC's recommendations for when communities are in the high level. And so we have certainly encouraged folks to consider masking when they go out in public, especially if you're in higher risk settings. And I think one of the things, as COVID is with us, and we know it's going to be circulating on a routine basis, it's important for folks to recognize there are certain settings that are just incredibly more high risk than others. And when you're in those kinds of settings where you're in close indoor proximity to a lot of people, it's important that you take additional precautions. And at the base of those precautions, if we think about multiple layers, is making sure we're vaccinated, making sure that you have that level of protection. So if you do contract COVID, you have the best chance of survival and low acuity or low morbidity disease.
I know you hate this question, but I got to ask it anyway. Is a mask mandate going to come back?
That's not planned at this time.
Okay. What about when it comes to vaccines in general? You touched on it, but do we have enough people getting those boosters? I know that's been a concern. And also, what about kids getting vaccinated? Those rates have not been what folks in your field had hoped they would be.
Certainly, I think we always have opportunity to do more. You know, our vaccination rates as a community have slowly increased over the last several months, but at a very slow rate. And so one of the things that when I was speaking to the county commissioners earlier this week, it's an area where we continue to work on the ground to ensure that we're creating access points in the community and providing education for folks who may still be hesitant or not aware that they need a booster, which is something that's really important for us at this time, is making sure folks who are eligible for boosters know they're eligible, and then creating easy opportunities. So we're still out knocking on doors, hosting community events, and making sure that people are able to access COVID-19 vaccines in the community.
Earlier this week, we did a piece on Wake Up Charlotte about how a lot of kids out there have fallen back on their routine vaccinations in the last couple of years during the pandemic for a variety of reasons. What message do you have for parents when it comes to getting your kids their routine vaccines as kids go back to school in the next few weeks?
Yeah, absolutely. Great question. I'm so glad you brought this up, because it's really important for us in public health as we respond to these ongoing infectious disease outbreaks that continue to arise in our community, that we use the tools we have available to keep others from emerging. I think you probably saw earlier this week and last week the talk of polio potentially in New York. And it's important for our kids to have those vaccines, because that's what allows us to keep these infectious illnesses under control. So if you have any questions or concerns, please call us here at the health department. We are doing a number of back to school events right now on the weekends, as well as in our clinics every day, to ensure that kids are up to speed on their immunizations ahead of going back to school. We will have also a number of events just before the CMS inclusion date to ensure that students are able to stay in school and have all the shots on board they need to not just stay in school, but to protect themselves from infectious illnesses.
Be honest, did you ever think we were going to be talking about polio again?
No. I will tell you that was somewhat surprising, I think, for many of us in public health, but certainly there's always the risk. And I think it's important it's an important message for the community, though, to recognize we don't think about often measles and mumps and polio and all those infections that most of us don't have to worry about because we've been vaccinated against. And the key to that is that we've been vaccinated against it. And so vaccination is a remarkable science, and it is absolutely critical to sustaining life and avoiding the impact of these kinds of infectious illnesses that continue to arise.
Remarkable science, and it's been around for a long time. It's not new by any means. All right, Dr. Raynard Washington. Doctor, thanks for coming on. We appreciate the work you're doing on behalf of the people here in Mecklenburg County.
My pleasure.
All right. More Flashpoint after this.